Thank you so much. Next, we will have Dr. Cynthia García Coll, who will be presenting our next speaker and moderating that session.
Well, good afternoon, everybody. Stretch up, please. Get some energy. We're not done. So let's do it. All right. So our closing presentation today is the next step in evidence-based policy, implementing and evaluating universal programs. We're thrilled to have here Dr. Ron Haskins. Dr. Haskins is now a senior fellow at the Brookings Institute, where he holds the Cabot Family Chair in Economic Studies and co-directs the Center on Children and Families. We had a wonderful conversation the other day where we talked about not only the large-scale policy opportunities, not the studies that he was doing, but to really talk to us about his wisdom, how after so many years of doing evaluation and research on this area would he put his money into. So let's welcome Dr. Ron Haskins.
Applause at the beginning is good. Applause at the end I don't get very often, so thank you. So I'm speaking at the end of a long day. I get to be last on the agenda. Thank you for that. But I do have the good fortune of being the shortest thing on the agenda all day, so take courage in that. I'm going to talk about three things. First, I'm going to talk about federal policy. Most of what I say will be about federal policy. Yep, I'm not close enough. Is that better? Okay, good. Thank you. I should have thought of that. All right, so first I'm going to talk about federal policy. Then I want to talk about the contrast between programs that are focused primarily at the local level. Many of them are national programs, but they're implemented and planned and so forth. They're controlled at the local level, especially as contrasted with programs that try to have much broader reach, and in fact, national reach in many cases. And I'll talk about that and give you some examples. We don't have really great examples yet, but I think it's a thing that people want to be able to do, is to have what you might call universal programs that would affect the whole country. We do have universal programs like Medicaid and other, safety net programs, but they tend to be very broad. They don't have a very focused purpose. And then the last thing I want to talk about is home visiting. Home visiting is in many ways the most interesting social legislation we've passed in recent years. It's fairly big. It's not huge like the safety net programs. But it represents a very large bipartisan effort. It's been going on now for a decade. It's been reauthorized. It has $400 million a year. We've spent over $2.5 billion so far. We have what I think is the best evaluation we've ever had of a national program. And it's something like a universal program. I'll show that there are some exceptions to that in just a minute. All right, so I want to begin with an example of foster care because it shows many of the things that I want to illustrate here. Foster care is an extremely interesting system, I think. If you look, somebody said, Kovalchuk, I think, said he loved history. If you look at history of foster care, it is truly a fascinating thing. So foster care, I'm going to say it has two big developments. One was in 1980 when Tom Downey from New York and George Miller from California created Title 4B and 4E of the Social Security Act. There are problems with the way they did it, but it turned out to be a money machine. That's what they were after. They wanted a lot more federal dollars to deal with child abuse and neglect, not just foster care, but adoption and treatment as well. But the way they organized it, the big money wound up being in Title 4E, which is the money that you have to remove the child from the home before you can really get the money. Well, think about the incentives of that. That's not great. A lot of people would like to leave the child at home. I realize there are people who think we ought to get them out of the home right away. And in the old days, we used to do it a lot faster than we do now. Now there's a much more focus on how we could keep the family at home, because we've learned once the child leaves the home, it's not good. They get a lot of different placements. They don't really improve in many cases. Sometimes they do, but often they don't. So that the whole design of that system is flawed. And I think almost everybody now agrees we need to change it, and there's been a big development in that that I will talk about in just a moment. But nonetheless, it was a money machine. We now have over $8 billion that can be used for kids in foster care and adoption. And I have always thought of that as a bank. If we could change the legislation, in terms of the legislation, we could use that money for treatment. And especially if the treatment were successful and we keep the kids at home, then we'd really be in business. That's what we want to do. The kids might be better off, communities might be better off, and we could use the same dollars. So that's a very efficient way to do it. And as I'll show in a minute, we're just about to do that. So the second thing that's important about the federal policy on foster care is that we did recently pass. I realize some of you are probably under the impression nothing bipartisan happens in Washington, but we just passed a policy that is bipartisan in nature, very surprising from my perspective, called Family First. There were virtually no dissenting votes. The House and the Senate worked together just like in the old days. The primarily Ways and Means Committee in the House and the Finance Committee in the Senate, and they created Family First. And the goal was to use the money from 4E for kids before they had been removed from their home. So the idea here, which in itself is a little bit challenging, is that we haven't really given these families everything they deserve before we remove their child. And this comes at a time when there's more. Now, these things are hard to measure. I'm not asserting this as a fact, but there's a lot of indication that many communities, especially minority communities and low-income communities, are really fearful of social services because they'll steal your child. I can't tell you how many people have told me that in the last, say, 4 or 5 years. They'll steal your child. I'm not saying that's a fact, but that's the kind of thing we need to worry about. We need the families to believe, we need the social workers to believe, and we need the states to believe that it's their goal to keep those kids at home as long as we possibly can, and meanwhile give the family services. You can't just leave them at home with no services. They have to have services. And that's a point too. We need to have more effective services. I'll come back to that in just a minute. We don't know how this is going to turn out. It reflects a lot of the trends in current policy. It has to be evidence-based. The states play a big role in it. The states have to submit a grant. HHS will consider the grants. They have to use evidence-based policy. The policy has to reach a certain level on the California evidence-based policy and child welfare clearinghouse, which is a thing of beauty for any of you who might be interested in something like this. So it gathers together a lot of the factors that are used in federal policy making now. And I think it's interesting to say that several examples in recent years, 4 that I can think of right off the bat, and then other examples going all the way back to 2010, one of which we'll talk about in just a minute, demands evidence base. And you can't get the dollars without an evidence base. Now, I'm not saying that means they really are using evidence-based policy or that our mechanism for deciding what evidence-based policy is good, but it's very interesting development. With that, talking about evidence-based policy, let me turn to I mentioned the home visiting before, and now I want to get into it just a little bit. It passed for the first time, there were previous programs, but in 2010, as part of the Obamacare, home visiting was authorized, and it's been growing since then. I think it's stable, bipartisan. Republicans have supported it. The typical Republican attacks, the Norris, that movie star, or TV star, I've forgotten his first name now, but he was enlisted by Republicans to make arguments, and they put them on TV ads and everything about this is the federal government telling you how to raise your child and so forth, and nothing like that worked. They've tried it at the committee level in the House. I watched it. It did not work. So that, to me, that's very encouraging that there's bipartisan support. There's a belief that we should support families and we should have programs that do that. The money is focused on low-income families, but not exclusively. You could develop these programs beyond low-income families, but so far the money has been focused on low-income families. And another current trend the Congress specified the outcomes that the states had to achieve. Again, they give the money to the states developed programs, and they gave a lot of money for a very high quality random assignment evaluation. And we are about to get the results of that evaluation. It's the first or second biggest evaluation we've ever had, in addition to teen pregnancy prevention, which we can talk about in a few minutes if you want to. But there are thousands of kids involved, 4,500 kids or something like that. Almost every state's involved, and so it's really going to be an interesting evaluation. And all these measures that I mentioned, there'll also be extensive data on spending and exactly how the states spent the money. And there's a separate study on implementation programs. So we'll learn about implementation, and hopefully you'll be able to learn things about implementation as it relates to outcomes and that sort of thing. So this is really, to me, this is, if you believe in this smaller, more limited approach of state level and local level programs, home visiting is a great example. And it also is a good example of a more universal program, which I'd like to turn to now and talk about just for a minute, because we could have programs that emphasize home visiting, and they could be organized like some of the programs described here today. I thought that some of the programs described here today were really, it was very interesting. Cincinnati was interesting, and several of the other, the Medicaid in New York, programs that try to organize the state, get everybody involved at the local level. And you could do that with home visiting. You could have, several states have chosen a model they prefer. There's something like 30, even more, I think 35 model programs that have been approved by HHS as evidence-based. I don't believe that for a second, but some of them, a number of them are really evidence-based. And the evaluation will have many random assignment evaluations of the 4 biggest models that are the most frequently used. So that's a kind of a rare thing in federal studies too. It's not just one home visiting model, it's 4 separate models of home visiting, like nurse-family partnership and the early Head Start and 2 others. So that's going to be a very interesting part as well. So 4,000 families, I think there are 88 sites, and there are 12 different states involved. All the states have home visiting money, but 12 states involved in the evaluation. And as I said, that evaluation is about to come out. It's written. HHS is considering it. I don't see that HHS is going to change it much, but it'll be out, I hope, any day now. It may be a little later. Once they get into the deep, the black box at HHS, you don't know. It's held a Head Start evaluation for something like 9 months, so it could be held a long time. But it is going to be out pretty soon, and I'm pretty sure it'll be a very, very interesting thing. Now, I want to talk just for 1 minute, and I'm going to make some how am I doing on time? We're not following the clock anymore, so I didn't know how to gauge this. I don't think we're going to end at 3:30. That's a prediction, but. No, we're not. You're fine. Okay. All right. Well, I don't want to go too long, though. All right. So I've been working with Deb Darrow from Chapin Hall and Ken Dodge from Duke, and they know a lot about home visiting, and they both believe in universal programs. And we've been talking a lot for a couple of years now about how we can encourage the development of universal programs and what data that now exists or that could be developed in the short run could we use to illustrate how to do this. So many of you probably know there's a journal called Future Children, and I'm one of the editors of Future Children. And so we all got together and we agreed we're going to do a volume of the future children. We're going to have 6 examples of, none of them are universal in a national sense, but they're very widespread. One of them is a huge program in Los Angeles County. One of them is in the whole state of New Mexico. So there are going to be a number of representatives of how to do this. And one of the most interesting, I think, is Ken Dodge's program, which in the old days used to be called Durham Connects, because he did it first in Durham, but then he started getting national funding. I think he now has, that is amazing, I think he now has 26 programs, all funded by zillionaires, and he has funded these programs, and they all have evaluations. They've created a national data center. They've created many local, more or less state data centers, and they're implementing these home visiting programs, all according to Ken's model. And the three most important features of his model are, first, that the model has to reach every family in the community. Now that sometimes falls down. There's no way you can guarantee that, but they identify all of them at birth in the hospital, nurses do. And they tell the mothers that they'd like to come visit them in their home. And a huge percentage of the mothers accept that. Chuck Norris was wrong. They want it. They like to have the advice of this includes middle class, mothers of every income and so forth. So most of them do accept it. And then the philosophy is, and this, for a universal program, this is what you have to have. You've got to have what amounts to an inverted funnel. You've got to start with everybody, and then you've got to work your way down. Many of you may know about Triple P, which is the same way. The bigger the problem, the more intense the intervention, because you've got to save your bucks for the more serious parts of the intervention program. The second thing is an assembly of all family resources. We've touched on this a bunch of times today. This is really interesting. And Dodge has developed this quite a bit in certain communities in the United States. He's got kind of like a phone book of all the available interventions in that community. And you would be, I've known about this for a while, but I remember the first time I looked at it probably 15 years ago or so. I could not believe the number of services that were available, government and private, in communities around the United States. And it's even more now. And so Dodge has got a list of these things because they use it, because the next step, if the mother and if there's a father, which in many cases there are, and they need services, they've got this huge book full of all the services available in their community, and they help match up the services with the families. And many of the families accept the services readily. They want to get services for their kids. So it's a very good idea. And I think in the long run, these lists of services and how you access them and how they get paid for is going to be a really important contribution, apart from what the impacts of this study are. And then the third is he's creating electronic data systems that show all the nurse assessments based on the birth record, and the nurse assessments, and then all kinds of other data. He's in every one of these communities, 26 now, they're conducting random assignment studies. They get a lot of data. They get administrative records from hospitals, from counties. They give individual tests on child development. So they have a whole array of data that's also included in the sort of the data treasury that they're creating in all of these communities. So far, he has 2 random assignment evaluations. They both have shown a fairly broad range of impacts. We've talked here about, which I think is true almost universally. They're not, you don't get effect sizes of 1.5, but you can get up to, 0.4, 0.5. Those are fairly respectable. And that's the kind of effect sizes he gets on a broad range of things, including some from administrative data, which really impresses me, because administrative data often is everybody in the, that live in the area or that are in a system, because they're in the administrative data. We have many examples in which administrative records are more complete than survey data, or certainly than research data. So it's a very good system, and those show big impacts as well, especially on childhood injuries, which is a very impressive outcome to produce. So I think there's an example. We'll know a lot more about these 6. We'll publish this thing in I think it's about 6 months now. So it'll provide some very firm examples for states and localities to follow. So I think this is we can do more universal programs, and maybe they'll have universal impact. Now let me conclude with a few things about federal policy. First, I mentioned the safety net. We spend about $1 trillion a year on means-tested programs. Now, I'll make that clear. Means-tested programs. This is not intervention programs in the sense you talk about them here. This is $1 trillion a year on means-tested programs. So this includes Medicaid, food stamps, supplemental security income, and so forth. The broad safety net programs are very difficult to change. I am not optimistic that, let's say you did recommend changes to SSIs. I'd love to recommend, well, we had a committee. You all had a committee on SSI, and I don't know what you recommended, but it's hard to change them. And the politics are very complex. Financing is complex and so forth. So then the rest of the federal spending, much less money, of course, composed, roughly speaking, this is a little bit simplistic, but of block grants or funding streams that fund a whole range of activities. I say housing is like that. They all pay for housing pretty much. There's some programs that also pay for job programs and so forth. But there are a range of different housing programs. And to some extent, food stamps is like that. There are a bunch of different programs that are supported by food stamps. So there are a lot of programs like that. Title 20 is probably the classic example, Title 20 of the Social Security Act, which basically just give the states money and say, do good things with social programs. It's a little tighter than that now, but in the old days, that's what it used to be. And by the way, as a result, that's been cut on several occasions. So Congress doesn't particularly like programs like that because they can't control them. But a number of these programs have specific purposes, like home visiting I've talked about here. It's had a very good half-life so far. It's got good evaluations. In many ways, home visiting is an ideal social program. The next thing I want to talk about in federal legislation is evaluation. I think the new style is to require evaluation. The Congress likes evaluation. Someone asked here, how do I get Congress to like programs? I think evaluation is one way. If a program it works and produces what the members want, they like that. And so if we're confident that a program will work or that evaluations will lead over a period, a fairly short period, to evidence that a program works, that's a good thing. That is a way to make sure that the Congress will do the best it can to continue the program. I really think that's a major reason home visiting has been so popular. And the last point I want to make, it's hardly been mentioned here, and that is the debt. The biggest threat to children's policy in the country is the federal debt. The day of reckoning is going to come. We've been saying that for a long time. There's a big budget meeting in the Urban Institute every spring, and all the budget wonks are there from OMB and CBO and so forth. And I've been going to that meeting for years and years and years. And I brought up this morning, I said, we've been saying for years, we had commissions, we had Alice Rivlin and Bob Reischauer, super influential people on these commissions, and nothing has happened. It's gotten way worse. This year was outrageous, the amount of money we spent because of the tax cuts. And now already we're talking about another tax cut that'll cost several tens of billions of dollars more. So, y'all, this is your problem. I'm serious. I'm very serious. This is your problem. Because it's my problem too, because I really believe in children's programs. And I would like there are a lot of new programs I'd like to support. I'd like a lot of things not to get cut that I know are going to get cut. Colleagues that I have that are, halfway on the right think that we ought to support families more. Some few of them on the right would like to have, and a lot on the left would like to have a broad-scale support program, a family income support program of some sort. There are various descriptions. There's active discussion now to do it. I'm on another National Academies panel, and that's a possible program that is, in our sight. So, but they're impossible. They're impossible. You can't pay for them. And I think we're going to lose money. In fact, I don't even have to think. Urban Institute does a fabulous study. They've been doing it now for something like a decade. And federal spending on children went up. Oh, it was wonderful. I used to write about it every time that came out. I'd write this thing, oh, good news, spending's going up. And now it's going down by several measures, and it'll go down more and more and more and more, according to both the Urban Institute panel and the Congressional Budget Office. So all the thoughts about spending have to be, they should be reined in, but you might as well join the group and be like everybody else and recommend another 20 or 30 billion. Now I'm going to answer questions, right? Is that right? You want me to go to...
Okay, so we have some questions already. Oops. Dr. Liu? No? Siniya?
That was spellbinding. What a great presentation. I did not take my eyes off you. That was absolutely spellbinding. Thank you. Little disheartening at the end, but other than that, I have a question about the family checkup. I don't know if you've heard about that a lot as a relatively low-cost intervention. I know it's not universal. Probably would come in at a later stage when families are in a bit of trouble. But I was curious about your thoughts about whether that could be a relatively low-cost, feasible thing to take to scale before problems really escalated to a point of seriousness.
I have heard of it. I don't know that much about it. I ought to be cautious. Did you say Brad Wilcox is doing it?
Tom Deshawn's family checkup.
Tom Deshawn.
Tom Deshawn?
Oh, okay. Yeah. I've heard of it, but I just don't know about it. Do you know what finances it?
Oh, he's got contract, or he had, rest his soul.
It's grant money, grant fund?
Yes,
Yeah.
and so with the military and Department of Defense and all over the country, he's got several grants. So I was just curious about using that as something that could piggyback onto the home visiting, just like Triple P might. Something, anyway.
Yeah. I wish my memory were better because I've heard a presentation about it and all that, but I don't remember.
Dr. Perrin.
Ron, thanks very much. So I'm curious about political will here and sort of what you think led to political will behind home visiting and has maintained its support. And we just had some conversations about sort of Child and Family Security Act or a section of the Social Security Act, whatever else. And some of the elements are paid family leave, family income support, child care payments, a variety of things. So can you help us understand where you think there is and isn't political will and why?
First, let me broadly make the point that I think children's programs are popular, and they often can enjoy bipartisan support. Last year in the budget deal, the 2018 budget deal, they threw in $2.37 billion for early childhood education. No one saw that coming. I don't know. I can't figure out. I still can't figure out how it happened. So it's not a rare thing. That's the first point. Second point I've already made, which is the program tests pretty well. I would give some credit. I know I probably shouldn't mention any particular program because I got a lot of friends that deal with all the various programs, but Family Nurse Partnership has really created a reputation for itself and for the idea that you can have major impacts on the families, including reducing abuse and neglect and so forth. So that's the second thing. A third thing is, if you think about what the program actually does, is it works through the family. To me, that's a very impressive thing that the Congress it's emphasized by many of the witnesses and staffers in the Congress emphasize it. We can help these families, and they'll do a better job. Their kids will turn out better. They'll reduce abuse and neglect, fewer injuries, less hospitalization, even an implication, I don't know how solid data is, but its cost-benefit numbers are good. So all of those things, I make a big difference. And then a very important one for people in this group to keep in mind is the organization of groups that supported home visiting was really a thing to behold. And they had fought in the past, tooth and nail. I mean, they really, I wrote a book about Obama evidence-based policy. I probably shouldn't mention it because there'll be a rush to the bookstores to get it, but it's called Show Me the Evidence, and there's a whole chapter in home visiting. I go through how the home visiting so-called lobby worked together, Well, they fought each other. They undermined each other, they broke every rule. And then they realized they were going to lose home visiting. So, boy, that brought them together. And now I think they're a very effective lobby. Maybe they don't speak with one voice, but they're good. They're good. There are a lot of guys in this town who make $1 million a year as lobbyists who don't do as good a job as they do. So I think that is definitely a very important factor. And think of it, they're working with kind of a predicate with an idea that Congress likes, that this is important for kids, it's important for families. So there are a lot of things about the program to like, and the advocates are taking advantage of that. And once they got together, I think they all saw very quickly how powerful they could be, and they were. That's why the original $400 million bill passed.
Is universality important?
What?
Is universality an important part of any of this legislation?
Well, it had more reach than any other home visiting program it ever had. It wouldn't be universal in some small states. Maybe it could be close, but in big states like California, New York, but it would be a lot more people than it was in the past. So when you build up a constituency like that, then when you get to the reauthorization debate, which we went through 3 years ago, yeah, that's a factor. That's definitely a factor because there's so many people out there that you can call on, and they write letters and testify and do all that kind of stuff.
Okay, next question.
So also on the theme of political will, so I'm reading a book right now by Manuel Pastor from USC called The State of Resistance. It traces
Called what?
State of Resistance. It traces the sort of the trajectory that California.
I didn't even know he had a state by that name, but
it's a very popular state. Trajectory of California as the demographics changed and the sort of political support for children and families kind of it was a very dark period at a certain point, and now it's
right.
The thesis in this book is on the uptick. So, as an observer of federal government for decades, do you have any insights or comments on the political will to support children and families as the demographics of this country changes dramatically, not just in California but across the country, and what the political will is to support, frankly, children and families who are no different than the legislators?
I always resist saying this, but honesty requires you to say that the more that a program supports low-income, minority, immigrant families, the Trump group, support for it declines. Now, if they're mixed in with, if you have the universal program, or if they're mixed in with more middle-class families, or if you can make Congress see that they're middle-class families and their communities that are affected, then that helps a lot. But I think it's no question that it is a disadvantage to try to raise money for low-income families. There have been several books about this over the years, and I hate to admit it, and I always try to lie to my kids about it, but it's true.
My question was along the same lines in terms of recognizing what you just said about low-income communities and communities of color. For this committee that's specifically looking to reduce health disparities, right? Do you have any recommendation, or is there anything that you've seen that's effective in terms of helping to close the gap, and especially for low-income communities and communities of color?
One thing, you can't go wrong with children. And to some extent, who cares if they're low income? If kids have health problems, then you emphasize that, and a lot of members of Congress who normally would not support programs for low-income families and minority families and so forth will support it because they want to help kids.
So the idea there is just to generalize.
And especially if you emphasize the point that our biggest problem in the country is inequality and a lack of progress to achieve the American dream. And health is a crucial part of that. So if we don't focus help on this group of kids, assistance with help with this group of kids, then their chances of getting ahead are going to be reduced. So we got to do that. And I think that's a popular message, and members of Congress will respond to it. I'm sorry I interrupted you. What were you going to say?
No, I was just affirming what I heard. Thank you.
Oh, okay.
I wasn't actually, it was similar to Nadine, but I was going to ask sort of to go further. Is so from what we heard earlier about the three-pronged social strategy looking at healthcare, early teen education, and family support, home visit in many ways captures that, like really systematically. It does capture that. Are there any other population level interventions that you would say we should also move towards? I mean, and then I want to say relatively, home visit still is only accounted for it's not even on the top 10 of expenditures for children. I just looked at the Urban Institute report. It's not even a top 10. So how do we either think about expanding it to get more of the dollars, or are there other population level interventions we should really be thinking about?
Well, the specific program that I think definitely we spend the most money on is early childhood. We spend $35 billion or something on childhood. I find many audiences like this are surprised by that. They find it hard to believe. But if you add up Head Start, daycare, and all, who said earlier today, Healthy Start, this start, that start, there are a lot of programs, and it's a lot of money. They don't have the same goal, but you make it seem like they have the same goal, especially child development. So that has been a good model for how you can sell a program. And here's another important thing. Every parent, including middle-class parents, they have to worry about child care. So I'll never forget, we have a program in the tax code that subsidizes child care, and almost all the money today goes, in the past was the same way, but in today's dollars, it goes to families with income of more than $100,000. So wouldn't it be a good idea? Nancy Johnson of Connecticut, a Republican, often introduced legislation to do this. Get rid of that program and give the money to poor people. Oh, I can't even begin to tell you the response to that, mainly from inside the Congress. And I had one extremely important member of Congress, I'm not going to call any names here, but one of the most important in this debate, because we're talking about something in the tax code. And he said, my constituents don't care about any of these benefits in the tax code, tax expenditures. This is the only thing they care about, and there's no way we're even going to have legislation on this. So, and he's been long gone, but we still don't have any serious legislation to use that. I forgot. I think it's $2.5 billion, $3 billion. It's not. So that's an example of another program that's gotten a lot of money from almost every different way you can get it, for almost every purpose you can think of. And again, I think the reason is because it's for kids. And it's for kids in a way that even middle-class families need. They may not get a subsidy from the federal government, but they're aware, yeah, child care is a problem. And one other point that's really important, and I think welfare reform, probably if we voted in this room, welfare reform might not get very many yes votes, but it made the point that low-income families could work, and they did work, and when they did, their earnings went up. But to do it, they needed child care. And that was a message that the public got. We expanded child care then. We've expanded it since, as I mentioned a few minutes ago. So more of those families get money now, but it's still less than 20%, if you can believe that. So there are ways to sell these programs, and child care is another big one.
Just picking up on this theme here. At the same time, there are these increases to early childhood programs. The administration continued to propose major cuts to social programs for the poor. So, for example, $1.4 trillion cut over the next 10 years to Medicaid, $214 billion cut to SNAP, $21 billion cut to TANF, $7 billion cut to HUD, all of which could actually impact on the health of children and families, perhaps even more than these early childhood programs. So I guess my question is, for this committee and the type of policy recommendations that we might recommend, how do we create the political will to support these programs that addresses housing and poverty and nutrition and so forth that are targeted to low-income families?
Okay, one point to make about Medicaid that it took me a while to really, I kind of knew it, but states do not like Medicaid. states, Medicaid drives their budget. And they have to suffer under the rule of the federal government, because the federal government for years expanded Medicaid, and almost every year states got a new, they had to pay roughly half, often a little less, but a lot of money, and it kept growing and growing and growing and growing. So there are governors that would just, not in public necessarily, but behind the scenes, they don't like Medicaid. So that, and they talk to their representatives and their senators. So Congress is well aware that Medicaid, there is this counterforce that you shouldn't expand Medicaid, no matter how much good it does. So that is something to keep in mind when you're thinking about Medicaid. I think that played a role in Obamacare, that if the states had to pick up part of the cost of Medicaid, now it's set up, as you know, so that the first whatever years it is, 90% of the money is paid by the federal government. But as all the Republicans who opposed it said, that period will end. And pretty soon we'll be paying 50-50 on Medicaid. And that'll break our budget. So I think that's a big factor in the Medicaid debate that is often not public. First of all, it's hard for the public to understand that, I think. It's a subtle point about how the federal actions on Medicaid can drive a state budget. So, and in most states, Medicaid is either the first or the second largest expenditure in the state budget. So I think that's the biggest single problem. Does that answer your question? I couldn't hear everything you said.
Partially. So that's with Medicaid. But what about programs such food stamps and housing, Section 8, these programs that certainly that target low-income families that could disproportionately harm children.
What tends to happen is that Republicans, especially since we've had President Trump, and even in the 2 years before Trump won, and especially Republicans in the House, proposed what I thought were really surprising cuts. And they were across the board. Housing, food stamps. And some of them passed in the House. At one time the House Republican Party was a machine. They pass whatever they want to. But it's harder for them to pass it now. And the Senate always stopped them. And if they hadn't in the old days, Obama would have. So we didn't really get any serious cuts in the programs that you mentioned, housing and so forth. I do think housing is vulnerable because housing doesn't have the strength in lobbying support, and a lot of people think it's not a great program. Food stamps has a lot of support. You can tell because the spending went up. It was amazing how much food stamp spending went up, and it still had a lot of support in Congress. And Republicans have proposed cut after cut after cut, and hardly any of them have been enacted except by the House during the period when they were cutting social programs a lot. Now, when we get to the point, which is coming, that we have to cut, I'm going to make up a number here, $50 billion in social programs, then that's when you'll see how much strength these programs really have, and they will be cut.
Any other questions from the committee? I have one, that I've been pushing to think about the sort of source of the problem, and for me, a lot of it is poverty and inequality here. And I'm trying to think as a Republican, which is hard for me, but, think that they really like tax cuts for, the rich and the companies. So I was in my wild mind saying, well, why don't we propose that one of the things that we can propose here is tax benefits for companies that give 25% of their jobs to the local communities. And that includes training, childcare, and maybe even transportation. But we give them a tax cut because they are giving some of the things that we think are important here for them. How does that?
I think that's a good way to think about it. I think that Republicans, some of them would support that. Republicans have proposed things like that in the past. The president's daughter, as you know, proposed support for family leave, and that would be financed in part by giving breaks to companies and others who would support it. I mean, there's so many, it's hard to keep track of what everybody's proposing, but that has been one of the proposals the Republicans really like. I think a proposal like that could pass if the companies paid for it. Now, it would have to, you couldn't make it mandatory. It would be a small thing. It'd be a small thing because you couldn't make it mandatory, I don't think. You could try it. If I were doing it, I'd try that first, and then I would have a backup position, which would be I would make it, optional for the companies to do. But that's not going to be a lot of money. That'll never be a lot of money, even though it's a good idea.
So you mentioned in your talk the importance of measures, outcomes, right? So what do you think policymakers want to see measured that makes a difference? Because there are 1,000 things to measure. There are things to measure on the impact on adults, on children, on families, on the community, et cetera, et cetera.
Yeah, I think the straightforward ones, reduction in spending in emergency rooms, reductions in the number of abuse and neglect cases, often things that you could get good data from administrative data sets. Those are the kind of things that I think policymakers, those would be impressive to policymakers. The kind of, tiny measures that we use. For example, a lot of people are interested in preschool programs. If you have performance on a test of reading or math, and you could produce, I think they would be modest impacts. And some members might like that, but I don't think it would really get them excited. But if you could show that they did better through third grade or fourth grade or sixth grade, that they had lower dropout rates, that they got higher scores on the state tests like in New York, that's the kind of stuff that the policymakers would really resonate to. That and cost savings.
Crime reduction?
Crime reduction, yeah, absolutely. Yes, definitely crime reduction. Oh, yes.
These are all measures that are distal to the programs. I mean, you can measure social emotional development, but that's not going to turn anybody's head, at least the policymakers who I've met, mostly at the state level. I don't work at the federal level very much. So, you have to there has to be some level of endurance to say, okay, I'm going to wait and see what happens. And as you know better than I, at least, that the endurance, the patience just doesn't exist. So what are the proximate measures? Is it the kinds of things that you mentioned that are easy to understand, health-related components that they see as important advances that logically are going to save dollars and logically are going to improve quality of life, and they're willing then to wait for the other components about high school graduation rates or our math scores compared to 50 other countries in the world. Maybe we'll move up to 49 at some point or something like that.
Yes, and I think for almost everything that we're concerned about, there are such measures. So social emotional development, how many kids get thrown out of school? How many kids are in some kind of emotional special education? How many kids are in prison, wind up in prison 4 years later? Those kind of measures that you could say to members of Congress testifying, before the Finance Committee or the Ways and Means Committee, say this shows that these programs are working. They keep these kids on the right track. And we've had a decline of 20% in the last 10 years and that kind of thing. That will definitely impress them. Those are the kind of things that I think are really impressive. And many of them are administrative data, so we have more reliable data. Now, on the other hand, it's hard to produce those kind of impacts. So, but if you could do it, yep, they would count.
So going back to your point about if we can persuade them that these funds are going to benefit not just low-income families, but middle and higher-income families as well, that would be one useful thing. Plus the issue about showing what immediately can you change. There's more and more evidence now that substance abuse and addiction has a U-shaped curve with family income. So it's the poorest families, but now increasingly the most wealthy families in the most affluent areas that have higher rates of addiction to drugs and alcohol. So I'm wondering if there's some way of leveraging this to say that, well, yeah, this is an issue. And actually, the Robert Wood Johnson Foundation has put this as the number 4th at-risk category. There's poverty, abuse, discrimination, and the 4th one is high-pressure schools and affluence. So the good news is that the affluent communities do not need monetary resources. It's more of an educational thing and so on. But so it wouldn't be taking money away from families in poverty. But I wonder if this could be one more way of saying, well, this is about all of our kids. It's not just about the Asian kids or the poor kids, so on.
If I'm understanding your question correctly, drug addiction, especially opioids, have reached the point that anyone who can show any progress and convince members of Congress that they actually have something that will produce progress, it doesn't make any difference who the families are or who the kids are. If you can actually help people and reduce drug addiction among any group, I think Congress will want to fund it. Because Congress is really in kind of a low-grade panic about opioids. It reminds me of the early days of my memory is some what? Another of crack? No, jeez. We've had 2 big previous drug crises. What was one?
Crack, everybody's mentioning crack.
Yeah, crack is one, definitely. That was definitely one in the 80s. And the virus that...
HIV.
Yeah, HIV. Thank you. Yeah. I'm pretty sharp.
Great. Well, thank you so much, Dr. Haskins and Dr. Garcia Coll.